All right, guys. So I'm going to be talking about some principles of Perthes. As you heard, we don't know a lot of what causes this, and the first visit in which you get the diagnosis can be really overwhelming. And I usually start my conversation with families by really trying to focus on the principles. As you've heard already, there are lots of different opinions when you go to different places, and that's why I tell people really focus on the principles and use that to guide you. So I usually start my conversation with new Perthes families by drawing this graph. And I put time on the x-axis and sphericity of the femoral head on the y-axis. And when we start out here at a perfectly spherical hip, and then you're kind of chugging along through life, and somewhere around here, the blood flow hit comes. Again, we don't know exactly what causes it, but somewhere after that is when people start to have symptoms, and that's typically when they present to a doctor's office. Sometimes later than this, but often this is when they do. And this is the initial phase of Perthes, and we'll talk about what that means on an X-ray in a second. But then you go into this second stage, which we call the fragmentation phase. And that's when it looks like on X-ray, like the bone is breaking up into little pieces. And what that is it's the result of the lack of blood flow, the lack of nutrients, the lack of oxygen to the bone that causes the bone to go through these changes as it partially gets resorbed, partially changes into cartilage. And the result, as Jennifer mentioned, is that it becomes mechanically weak. And through this process, you can start to lose sphericity. So you can start to decline as the shape of the hip starts to change. Then the blood flow comes back. The bone starts reversing from cartilage back to bone, and it starts re-ossifying. So that's the healing stage. And you start getting some gains in sphericity, and then you kind of level out somewhere for the rest of your life. And we can't change the stages that these patients go through, but we try to modify them. We try to speed them up when we can. We try to make the decline less, and we try to shift the curve. But it is important to understand that every kid's going to go through these stages. And here's a little bit more of a orthopedic specific or a more technical picture, but it shows the same idea. And this is from Benjamin Joseph's work, who's a colleague of ours that's worked in India for a number of years. Again, X-ray starts out looking pretty normal, starts to get a little bit darker on the X-ray. Then you start to see some collapse. It looks like it's breaking up into pieces. It's not breaking up. Those are just areas of cartilage amidst the bone, but it looks like that. So that's why we call it fragmentation. And then it goes into a little bit more, and then it starts to reossify as you get into stage 3. And then you come around and hopefully you're ending up with a nice round femoral head. The goal here is all about sphericity. Okay. So when patients come to see me, they often have pain, they often have a limp, and that's the short-term concern. And I totally understand that. As a parent myself, I understand it's hard to see your kids suffering. But the long-term goal is that we want to keep the ball as round as possible. I know that that pain is going to get better and that limp is going to get better in the short term. But in the long term, those symptoms can return if we don't keep the femoral head as round as we possibly can. So it's all about maintaining sphericity. So in your first visit, you feel like you're not just drinking from a fire hose, maybe from a fire hydrant, and there's a ton of information coming at you. And as a Perthes patient and a Perthes family, you just want to rip your hair out. You don't know what to do with all this stuff, especially with all the uncertainty that we've already talked about today. And that's what as I said, when I started this talk, I think it's really important to stick to principles. How different surgeons may execute those principles may be different, but the principles really should be universal, and that's where you should start the basis of your discussion. So my first principle is offloading the hip. So if you think of the femoral head or the ball as this mechanically weak object, like a big ball of Play-Doh, and if you pushed on that ball of Play-Doh, you would indent it, right? So in a perfect world, we would take our kids that have Perthes and we would wrap them up in bubble wrap and we'd put them on the shelf for the couple of years that they go through their disease. And we protect their hip from all the everyday stresses of jumping around and walking and running and so on. And obviously we can't do that. But the idea is the same. If the more we can protect the femoral head from taking the forces, the less likely it is to deform. Now, that can take a lot of different forms depending on the surgeon and the patient and the circumstances. Wheelchairs are often used, walkers, crutches, all that stuff can be used to really try to keep weight off of it. And at the very least, a lot of us will recommend staying out of vigorous sports and high impact activities to try to limit these forces. The second principle I want to talk about is containment. And this is a buzzword that you'll see on most websites that talk about Perthes. And what does this mean? Well, the analogy I tell families is a little bit like ice cream in a bowl. So the ice cream in this analogy is the femoral head and the bowl is the socket. And if you take ice cream and you pack it into a bowl and you take away the bowl, you're going to have round ice cream. So the idea here is to use the socket, which is normal in Perthes. The disease is on the ball side, not on the socket. We use the socket to help mold the ball as it's going through that soft if you will, stages that we talked about earlier. And so there's some really parts of this that you have to keep in mind. You can only contain a hip that is soft. And once it is reossified, and if it doesn't fit, you can't apply the principles of containment. The other thing to say is that there's lots of different ways to contain a hip. You can bring the legs out to the side, like we often do in bracing or casting, and that dunks the ball deeper into the socket, which achieves containment. You can do surgery on the femur side to tip the ball deeper into the socket. You can do surgery on the socket side to bring the socket over the ball. But the principle is always the same. Use the socket to mold the ball. The third principle, and I think perhaps the most important principle, at least that families can focus on, is motion. Okay. And the analogy that I tell families is about a ball of Play-Doh. So if you have a piece of Play-Doh in your hand, you're watching television, you're not paying attention whatsoever, and you roll that piece of Play-Doh around and around and around, and you look down in your hands, it's going to be spherical. So motion creates sphericity, and sphericity allows motion. So I tell my kids, if I was on a deserted island and I had no access to x-rays whatsoever, I'd still be able to treat Perthes because I would just treat people's motion. And if I kept their range of motion pretty good, then we'd probably be in pretty good shape. And so I tell families very early, you got to get the hips moving. Most kids that we see, especially the ones that are very symptomatic, are usually quite stiff. And you really need to get that hip moving, not just because it's right for their function, but also because it helps preserve the sphericity of the hip long term. There's lots of ways to achieve motion. Physical therapy can be done. Sometimes we use injections, like cortisone injections, to get the hip feeling better, to be able to move. Often, many of us use braces or casts to kind of to stretch hips out and try to get this motion back. But this is a really key factor. Think about that Play-Doh, and I think that'll help you understand the treatment that you're being recommended. The last principle is age. So we know that younger kids tend to have a more benign disease course than older kids. In the world of Perthes, under 6 is considered young, 6 to 8 is kind of intermediate, and over 8 is old. And the older you are, the less remodeling capacity there is in the hip. And conversely, the younger you are, the more remodeling capacity there is. So people often ask me, well, why do younger kids do better? Well, they just have more years to grow and reshape their hip. And I tell people they just have more pixie dust in their system. They have more ability to kind of bounce back and be resilient and reshape and kind of outgrow or use growth to their advantage. While older kids that are closer to puberty just have fewer years left in which they can kind of recover the shape of their femoral head. So when you see your doctor for Perthes, there may be a lot of options that are talked about. But at the end of the day, always come back to your principles, and that will usually lead you in the right direction. Thank you.